patients that are more susceptible to corneal abrasions are usually dry eye patients. Hi everyone, I'm Dr. Toor from Amplify EyeCare here in Olympia, Washington, and today we're talking about corneal abrasions. So corneal abrasions are also referred to as just a scratch to the eye, and it can happen suddenly due to an injury or if something gets stuck under the lid and is causing scratches to the eye as you blink. Usually it is followed by a lot of pain, and that's because the cornea actually is innervated, so it has a lot of nerves on the front surface, and so if it's like you got a scratch on your skin but on your eye, it's going to hurt, especially when you blink, and sometimes you might have a hard time closing that eye. And so patients that are more susceptible to corneal abrasions are usually dry eye patients, patients that wear contact lenses, or someone that works in a dusty or debris-filled environment. If you believe you've gotten something in the eye, it's important to wash it out, make sure that you're not rubbing the eye, as that can cause more damage. And then especially if you think you have a corneal abrasion, it's important to go see an eye care provider. It's always a good idea also to just wear protective eye gear when you're in an environment with debris and dust. So what do you do if you believe you have a scratch on the eye? First things first is you call your eye doctor and you want to speak to them. It's important to get seen because even though a lot of superficial scratches do heal on their own or with artificial tears after a few days, our biggest concern is infection. So we want to make sure or prevent any infection from occurring. So kind of think of it as like an open wound. Bacteria can get in and start infecting the eye. So a lot of times antibiotic drops are used, and there can be other drops also used to help with the healing of the eye. And if the corneal abrasion or the scratch is more on the larger side, doctors might use what's called a bandage contact lens, just for helping with the pain and helping the healing a little bit. So again, depending on how deep or big the scratch is, either it'll heal up in a few days or you might need a little bit more follow-up after that. But usually if it's taken care of properly, they heal well and do not scar unless they're more deeper, then we do have the risk of scarring. But always, if you think that you have a corneal abrasion or a scratch to the eye, it's important to go see an eye doctor to make sure you're getting the treatment that you need. Thanks.